Welcome. Thank you for joining us today for our Strengthening Families Networking webinar. Every once in a while, we spend this time in what we call a technical assistance clinic, which is just a chance to answer some questions and get conversation going about strengthening families implementation as opposed to a presentation on a specific topic. So thank you all for joining us. Thanks to everyone who submitted questions. I'll just share a few details before we jump in. I'm Kaylin O'Connor from the Center for the Study of Social Policy. We co-host these webinars each month with our partners at the Children's Trust Fund Alliance, and it is an open invitation to anyone who'd like to attend to learn more about strengthening families or about a particular topic that's being covered. Typically, we have a topic and a guest speaker. Today, we are in the family here, just answering questions and hoping to get some conversation going about the questions that folks submitted. You can always find the recordings and materials from past webinars on a Google site that the Alliance maintains. So I will put that link in the chat in a moment, but you can always look there if you missed one or if you wanted to go back and find some content that was shared. We do this the second Thursday of each month at this time, 3 o'clock Eastern. Normally it's an hour, but every once in a while we do an hour and a half when we have a topic where we want to get into more discussion. So next month will actually be one of those times. We will meet on April 14th, and our topic will be Parent Nation. Dr. Dana Susskind and Yoli Flores will be joining us, and they will be talking about a book that Dr. Susskind wrote, which will be released in April. And we will actually be able to give, not we, the TMW Foundation will be able to give free books to the first 200 people who register. So we don't have that registration open ready yet, but once it is open, you will get the newsletter announcement and jump in there and get registered so you can get one of those books when they come out. We'll get that out soon. We are also still looking for a couple more panelists who will read the book in advance and be ready to respond and have a conversation with Dr. Susskind about the book. So if you're interested in that role, please let me know. And then just mark your calendar for those upcoming second Thursdays of the month. You can always hold the spot, and if it turns out it's a topic that's not quite your interest, you open up an hour for yourself on your calendar, but you can go ahead and save it. All right, so today, as I said, we're going to do this technical assistance clinic. Then we have some updates at the end. Maureen Durning is with us to share an update from Butterfly Trainings That Transform. Then we'll hear updates from the Children's Trust Fund Alliance, from Teresa and Lucretia, and from myself at CSSP. So it'll be an action-packed hour. We are excited to jump into it. So the idea with the technical assistance clinic is just an opportunity to get your questions answered, learn from each other, share your experiences, and maybe even identify some opportunities to collaborate. So if somebody says, oh, we did this, feel free to reach out in the chat to them and say, could you send me that document? Or could we talk sometime about what you said you were doing? Because that's how we learn best, I think, is from folks who have done similar things or are working in a similar context. And we always want to encourage that kind of connection. The other thing I want to add is we might not get through all the questions that came in today. I'll actually show, oh, here we are. This is who's responding to the questions, the three of us and all of you. But I'm going to jump past that to say, we want you to jump in. You can you can raise your hand and I will unmute you, or one of us will unmute you. You can type into the chat where everyone can see it. You can type into the Q&A where only those of us who are panelists can see it until we respond to it and share the response with everyone else. So if you want the general other participants to respond, do that in the chat. If you want us to respond, put it in the Q&A. And please do raise your hand and jump in if you've got something to share. So I'm putting up on the screen right now, you can see the list of topics that we got questions about. Some of these are just one question, some of them are a cluster of questions. So we'll go through them. But I did want to say anything that we don't get to or any questions that come up, a good place to take those would be to our Strengthening Families National Network group on Facebook. You are always welcome to go there and post a question. If we don't get to some of these things and there's an answer I wanted to share, I will post it there in that Facebook group, and that group should be findable by anyone. You do have to, request to join and answer a question saying that you do have something to do with strengthening families. We're trying to keep out sales and things like that. But other than that, everyone's welcome in the group. So think about that as a way to get some questions answered if we don't get to them all today. All right, So I'm leaving this screen up for a while so you can all see it, because you could already be like, "Ooh, I have a great answer to question G," and start typing. That would be fine. But for the most part, we're going to go through these in some sort of order. Oh, thanks, Lucretia. She put the Facebook group in the chat. So we are joined by Lucretia Rose and Teresa Rafael from the Children's Trust Fund Alliance. Teresa is the executive director of the Alliance. Lucretia is the co-chair of the Alliance National Parent Partnership Committee. The committee? All of a sudden that word went out of my head. But
that's okay.
Council, of course, Parent Partnership Council. So we're going to talk through these questions. Some of us will have more answers to some of them than others, and you can jump in with your thoughts as well. And I'm going to show the questions on screen, but try to stop sharing with the hope that we might be able to see more of you. Although actually, I guess when it's a webinar, I don't know if we can see everyone. So maybe that part doesn't work, but please do feel free to jump in and share at any time. So the first set of questions we got were a number of questions that I kind of grouped together here about engaging parents. So how do we bring more families to the table? How do we recruit parents for parent cafes, which could be true for a lot of other efforts as well? How do we overcome stigma there might be about coming to something that's about parenting? How do we get parents engaged? How do we maximize enrollment into programs like mentoring was a specific question. And how can we get more fathers involved? So I think that Lucretia and Teresa both probably have a lot of thoughts about these. So why don't I stop talking and let you share some of what you think on these ones?
Lucretia, why don't you start?
Sure, I'll be happy to. So I've been doing work with parents for quite a while, and it has been a learning journey, and I still continue to learn all the time. So that would be the first thing I would say, is that no matter how great we are at building relationships and engaging parents, you can always learn something new or better, or a better way to do it. It has been my experience in bringing families to the table, recruiting parents, getting fathers involved. Honestly, it all starts with relationships. So there's not one magic thing that works. Of course, you can provide dinner, you can provide honorariums, you can have things that engage their children that they're interested in. But really, it's about relationships and partnerships and valuing what each other can bring to the table. So not just what you can do for parents, but what parents can also do with you in your organizations or in your communities. Also, when you ask parents questions, that you actually do something with their information that they give you, so that they feel valued and they feel like they actually have a partnership, and they'll be more inclined to return, right? They'll, if they feel valued and you're building relationships with them, I find that that really is kind of the secret sauce. Now, how you do that depends on the culture of your community and your organization, because I know sometimes in organizations you have certain things you're allowed to do and certain things you're not allowed to do. So for instance, you might be able to have a one-sided kind of relationship. Of course, like you wouldn't share anything personal with the parent, but they might share personal things with you. And that's okay. But really, whatever it is in the culture of your community that will make that relationship work so that it's more of a partnership is the key. Partnerships are hard. Relationships are hard, but it's worth it. It's worth the investment, and they take time.
Yeah, and that's great, Lucretia. Thank you. And the only thing I would add, I'd say ditto everything Lucretia said, but I would add from a staff perspective that what will lend a lot of credibility to your outreach to parents and just help you do it more effectively is if you can identify even one or two or three, but whatever access you have to parents, to find at least one parent who's willing to be your partner in strategizing how you outreach to other parents, so that you have the benefit of that parental wisdom, but you're also modeling what you hope to achieve, and it makes you a more credible contact person, setting up things like honorariums if you can, a key contact person if you can. Sometimes people let let it become a barrier that they don't have everything perfectly in place. And again, if you have one parent you know that you can invite to meet you for coffee or talk to you on the phone, and just start strategizing together. If you want more dads, find a dad to talk with you. And you might have to go through a couple of people to find, a dad who's available and willing and interested. But it's well worth the effort. And that's, that journey of 1,000 steps. That's where we always see great success if you can start there.
Yeah, I wanted to add in too, I think everything you both said makes so much sense. I think another piece, there was the specific question about parent cafes, and I think, it takes some work to build up the group that's going to be your table hosts and help to put on the cafe. But the power of that process is that those people are then really invested in it, and they're going to recruit from their networks and their neighborhoods or preschools or whoever to bring people in. And what we often find with the cafes in particular is people attend one and then they say, oh, I want to do this. How do I get involved? And that's a great kind of ladder up to more and more engagement and leadership. So you might even sometimes find your first cafe doesn't have as much attendance as you want, but the second one will be more because people bring somebody because they said this was really cool. We need more people. So come on. And I think that snowball effect and word of mouth is really important. But it starts with those relationships that you have to build kind of one-on-one. Okay, so I know our next question, and I encourage anybody else to type their experience into the chat. You're all being quiet so far. The next question was about resources that are specifically for parents to reach out to other parents and help build protective factors. And we are lucky to have a resident expert on that. So Lucretia is going to share some about that question in particular.
Yeah, I'm going to share my screen with you guys. Some of the best partnership that I've experienced in my life and in my parent partnership journey is with the Alliance. And that's mainly because from the very beginning, we're involved in everything from the time something's an idea until it is embedded, into communities or into your states or into your lives. And in part of that work is really, we're allowed to dream big and we're allowed to, work within our own means and shoot for our own goals. And so we at the Alliance on our website, and I'll put some links in the chat here in a moment. When you go to our website, there will be, let me go to the main page first. This is what it will look like when you get there. And at the very top, there's a parent voice section. If you click on that section, it will bring up our parent voice page. Anything we have new up and coming will be at the top as a banner, but you can scroll down and this is where the newest parent voice materials live. So you'll see here that we were honoring parents as heroes and the ties that they have to their communities and their cultures. There are activities and social media campaigns, and all of these items are made for parents by parents, and they're all about protective factors. Really lifting up heroes in their communities, and they talk specifically about how protective factors made a difference in their lives. So not only do we have different stories, there you see me. I don't know why I have on my pearls there, but I did. So that's one page. That's one part of the resources. And if you scroll up to the top, and you go back to that partnering with parents section, you'll see all of the different areas here underneath the partnering with parents that we have parent materials. So the parent voice page is the newest materials, but there are many materials underneath each one of those subtitles. So if you click on the ANPPC, which is the Alliant National Parent Partnership Council, and you scroll down, you'll see our members, you'll see who we are, and you'll start to see lots of materials, both in English and Spanish. We have these one-pager infographics that we worked really hard with, taking the logic model for building protective factors and those small everyday actions. And we developed questions that get to the answers of how parents are building protective factors in their lives each and every day. And so they are front and back, they are in Spanish and English, and they're free and downloadable to you. And there's one for each protective factor. We also have parent acrostic tools that let you help to find out where are you at on your parent journey? Where are you at in partnering with parents? And there's an acronym here that talks about building partnerships with parents and what that looks like and what it really takes and the questions you might want to ask yourself. We also did a survey here with this tool. It's a front and back, and it's a question mark tool that says, what are the top 10 ways you partner with parents? And on the back, there is a place where you can walk through 4 different steps of partnership. And there are questions there that let you dream together in partnership. So not only are these designed for parents by parents, but you can also use them in your communities, in your organizations. We have a tool here that's in English and Spanish that talks about building protective factors specifically surrounding COVID. And we really wanted to know how folks are, building protective factors through COVID. And then we also have just many more. We have conversation guides about social emotional development. That's available in English and Spanish. It has PowerPoint suites. It has lots of things that go along with it. And then we have a social media campaign that breaks down each protective factor into small little chunks that you can share on your Facebook pages or your organization's website. But all of these things that are here are for parents by parents, but we really encourage you to use them in your organizations in any way that you see fit. There's a lot of material here, and so I don't want to take up your whole webinar explaining all the materials, but I will put some links in the chat for you and encourage you to explore that. As you can see, we have lots of different parent councils here or parent bodies that the Alliance works with. We have a Birth Parent National Network. We have the Birth and Foster Parent Partnership. And so any specific area, we've got you covered. So I encourage you to take a look and explore some of those materials.
Excellent. Thank you, Lucretia. Knew you'd come through on that question. See a couple thank yous coming in the chat there too. I'm going to go back to sharing our questions here. Well, there we go. So one of our state leads asked a question specifically about other folks who are convening state leadership teams and whether you have funding for that. And if so, where does that funding come from? So I'm hoping there are others on the call who are state leads. I haven't actually scrolled through the list to see if any names jump out at me. But if you are on the call and you have funding or have had funding, please jump in or type it in the chat. I will say, well, while we wait and see if anybody else chimes in, we have seen people fund their Strengthening Families leadership teams through things like ECCS, the Early Childhood Collaborating Systems, when those grants were at the state level and it lined up correctly. I don't think it's currently quite aligned that way, but there could be other opportunities through various things that are focused around early childhood or around parent engagement or around child abuse prevention, that there may be opportunities to use some of that funding for your leadership team. I will also say that leadership team activities don't need to cost very much. It's mostly staff time. A lot of it will be in kind for, you have a staff person who's like scheduling the meetings and making the agenda and making sure everything's happening. That takes a significant chunk of time. And then there's the in-kind donation of staff time from others who are participating, and some amount for parent stipends if you have parents sitting at that table, which we hope you do. But it can be done pretty inexpensively. Of course, if you've got funds and you can do a lot more, you can, be sponsoring trainings and putting things together, doing social media or social messaging campaigns, things like that. But I don't see anybody else jumping in with thoughts about that funding question, but we'll leave that on the table. Then we have a series of questions that are really about how you implement Strengthening Families at a program. So for some folks who are newer to Strengthening Families, these questions are always really relevant. I'm gonna share a page on our website where you can find such things. Oops, I'm actually on the translated Strengthening Families materials. We're going back to that one in a minute. But if you go to CSSP's main Strengthening Families page, which by the way, you can always get to by typing strengtheningfamilies.net, you can find lots of information, tons of stuff under these few little tabs. But in particular, I was going to point us to practice, where we have a whole page about self-assessments for programs that really helps you see the full self-assessments that you can use for for center-based early care and education, for family child care programs, for home visiting, and for community-based programs, which is like family resource centers, parenting, group-based parenting education, but other programs can use that community-based one as well. You can download any of these and use it as a hard copy, print it out, send it to people, or you can, fill it out on the PDF, but you can also go into the Strengthening Families evaluation portal if you want to get more, collect information from a number of people, add in parent surveys and other pieces. The other piece I wanted to point out here, as we think about sort of how you get going on implementing Strengthening Families in a program, this would not meet the question of the sort of step-by-step instructions, but we do have protective factors action sheets that can be really helpful. So each of these, we'll go to the ones that are for general child and family serving providers, but note that there are ones specifically for child welfare as well. And what you see in each of these is a research brief about this protective factor, how we define it, why it's a protective factor, and what it looks like. Then on the back is an action sheet. So about what your role is in your daily interactions with parents, how you can be helping parents build that protective factor, some questions you might ask parents, what you're looking for in parents, and some potential activities to do with parents. So these again you can apply them across a lot of settings, and they are meant to just get you thinking about how you could apply it in your own practice. I'm going to stop sharing that and see those questions. We also had, how do we ensure integrity of the framework while keeping it relevant across sectors? And I think what I just showed you kind of shows that, which is that the protective factors and the Strengthening Families approach are really about the mindset you bring to your interactions with parents. And we can have fidelity to that approach and mindset, even though we know that some people are implementing it in early care and education, and some people in home visiting, and some people in child welfare case management, and some people in their church, right? Wherever you are, when a parent walks through the door, you can engage with them in this way. I'm not saying it's easy to ensure fidelity that way, because we can't really say, well, did you do this, 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 and this? This was your third meeting with the parent, you had to do this, this, and this. It's not that structured at all, but it is more of how can you have integrity to these core concepts and the approach of taking a truly strength-based approach to parents. So I wonder if others want to add in there. I just talked a lot.
I would just reinforce that it really doesn't matter what setting you're in. There's a place for the protective factors framework and approach. And just to support what you said, Kaylin, we see it everywhere. And even individuals in their neighborhood, talking to a neighbor, it really becomes sort of who we are and what our message is, and sharing it wherever we can. We always talk about infiltrating all the systems that touch the lives of families, but it really goes even deeper into community and neighborhood too. So just to support what you said.
Yeah, and thanks Teresa, I saw Maureen's note in the chat. We find that using the protective factors language consistently assures fidelity. I think that's true. Just always coming back to, okay, what is it about what you're saying that would build this protective factor, or how would that be related to which protective factor? That can be really grounding, and it can be really helpful when you're talking across models or across sectors where you don't really speak the same language all the time because you have a specific curriculum you use, or whatever that might be. So using the protective factors as a common language can be really helpful. The other thing I wanted to say is I didn't go into the self-assessments, but if you look at the self-assessments for each of those program types, they all go through the same set of everyday actions. And so the everyday actions are similar to what you saw on that action sheet, where it's like 4 to 6 things to be doing in any type of setting. But in the self-assessment, then it says like, okay, so validating parents as decision makers, what does that actually look like in an early care and education program? And there are really specific things that you can rate how well or how consistently you do those things. And that will also give you new ideas to try. Okay, and I see a question came in the Q&A. We will come to that one. I just wanted to note, Taylor, we see that. We're going to work through a couple more of the ones that were submitted in advance, and then we'll get into some of our today questions. So let me go back to the slide. So we have 3 relatively, well, maybe not quick. We have 3 questions on here, not quick. The first one is relatively quick. How to find resources in Spanish for family child care providers. And actually, a lot of what Lucretia shared were materials that were written by and for parents that have been translated into Spanish and can be useful for other audiences other than parents. So it's not like we need to say something different for a family child care provider than for the parent when we're talking about why these protective factors matter and how we can strengthen them in our own lives. And that translates pretty easily into how you help others build it. But I will say we have a couple specific translated resources, which I clicked away from before, but I'll go back to. So where we were here on the Strengthening Families part of our website, it's actually right down under approach. You can get to translated Strengthening Families materials. And we have just a few here that are sort of core. We have a brochure for parents that's been translated. We have the pathway to better outcomes that has been translated, and the parents' assessment of protective factors, both the survey tool and the scoring sheet, are available in Spanish. But we also have sort of a crowdsourced approach, so that we have asked people in the network, and you can certainly add to this, anyone who's listening right now, to provide us with tools that they've translated, and particularly in Spanish is where we have the most. And I wanted to point out the Strengthening Families Family Child Care Self-Assessment has actually been translated into Spanish. This is incredibly valuable. And I want to thank our partners at the AFL-CIO in Massachusetts who did that for their members who are family child care providers, because I think we know that family child care providers, one of their great strengths is they often speak the language of the children and families that they're serving. And so we want to be able to help them do the same kind of quality improvement and rethinking, not rethinking, but refreshed thinking about how they support the families they work with. So really thrilled that that is available, and lots of other materials are available as well. I believe we have a little glitch on the website right now where it might not let you into that folder. If you click on it, you'll have to request access and I will grant it. And we will work on getting that link corrected on the website. But you should be able to get in there and see those materials, download them, and also add your own if you have them. And I see, Taylor says, I spy the PCA, the Prevent Child Abuse North Carolina 5 Protective Factors PDF in Spanish. That's right, we got it in there. Thrilled to have that. And I see Becky Mather has put in a topic here about, or a chat, that we have a public awareness campaign to communicate protective factors concepts to families and communities, 5forfamilies.org, which has a Spanish version and linked resources there in Spanish as well. So from the network, we have lots of great options. And I literally just heard my phone buzz because someone's requesting access. So I love that. I will grant you access once I'm not on camera. Okay. And Teresa put in a note about the Alliance's online training that is being translated into Spanish, with one module available and the rest on their way. So that's very exciting. Okay, I wonder if, to keep it mixing things up, if we should answer Taylor's question about updated PowerPoints you can use for protective factors trainings. I'm going to, I think if I type an answer here, then others can read it as well, I think. So see if you can see that. So the question is about whether there are updated PowerPoints you can use for protective factors trainings, particularly for virtual trainings. And the answer, unfortunately, is kind of no. I mean, we have various presentations on the website. None of them are super up to date. We are doing some work, as many of you know, on updating and refreshing Strengthening Families materials, and those PowerPoints are on my list of things that we need to get newer versions out of. But I also think the Alliance has some things that are generally for the trainers, for certified trainers, and others might have slides that are available on their own websites that you could share in the chat too. I think our slides are a little bit 2018. We haven't really updated them, so it's on my list that I think would be really good to get out there. Okay, I'm gonna go back to share my screen just to remind us of the questions we were looking at. One about the importance of culture in strengthening families. And of course, one of the reasons that we want things translated into Spanish is because we know how important culture is and reaching people in their native language. On this topic, I mean, we could talk for a whole hour for sure about the importance of culture, but I will mention a few things and hope others will chime in too. We always talk about the protective factors as being universal, that they are strengths that all families have and all families need, but depending on culture and context and history, they may be expressed in different ways and they may show up in different ways. And one of the things that all providers need to be able to do in order to serve families of all cultures and backgrounds is to have, we refer to as cultural humility, which is that idea of looking for the strength, even if it doesn't look the same as it looks in your culture and your family. So not coming in and saying, well, I don't see this exact thing happening, so it can't be, this person doesn't have knowledge of parenting and child development at a strong level or whatever. When in fact, what you need to look for is, what are they doing that's supporting child development? What is their understanding and belief about child development and what milestones they want their children to be achieving? And there's an interplay between, sometimes we all have some cultural beliefs that are not scientifically accurate, right? So a lot of us were maybe raised with some strategies that we now know science has shown us are not as effective, and that's true across all cultures, but there are also cultural values that come through that really do resonate. So things around nurturing and attachment are true universally. I'm thinking of, the newer research that has led us to always advise parents to have babies sleep on their back. That is not how a lot of cultures traditionally did it. We know better, and so we teach that, but we need to also teach that in a culturally respectful way. That it's not that I happen to know better than you do, but more that we've all learned as a world that babies are safer if they sleep on their back. So we promote that. I also want to say, I think there's a lot of value when we, as providers, can start to see those strengths across different cultures and then let parents tell us about the strengths they see in their families and in their communities in their own words, which often do align with what we can see in the protective factors, or they can take those protective factors and put them into words that resonate in their community. And that can be a really powerful experience for both for the members of that community and for the person who came in to tell them about protective factors, who may learn a lot about how that can look in a different community than their own. So I will stop talking and see what others want to add.
I would just say to Kaylin about the importance of culture is one of my favorite things Brene Brown says is, you know, it's not a question of whether we have biases or not. It's a question of what are they, how many, how do they affect our lives, and that, you know, we're all raised a certain way, right? And we all have these biases that we're kind of, whether good or bad, it's our culture that we grew up in. And so back to that relationships, you know, building the relationships, getting to know families, finding out, like you said, what their strengths are. But it's not a reason you're gonna make mistakes. It's gonna happen. But it's not a reason to not have those courageous conversations, you know, and find out what exactly they value about their culture and their families. And also, you know, you can learn from each other in that. And just one of the things I think about, we talk about this in training all the time, is eye contact. I was brought up that that is a sign of respect. And there are many cultures that I work with that that's a sign of disrespect. So I wouldn't know that unless I built a relationship and really found out what families value and support in their own culture. So I just wanted to say that.
Thanks, Lucretia. The other question that was on that slide was about implementation in the community. And the person who wrote in that question, if you are here and you want to add more in the chat, please do, but just those words in general. I think when we first started implementing Strengthening Families, we were really focused on what programs could do, in particular early care and education programs, and then it kind of rolled out to other types of programs that serve children and families. But what we increasingly know is that there are lots of ways to make sure that families get support to build their protective factors that have nothing to do with what program they're enrolled in or who, you know, who they're talking to that's a service provider, but much more about how our cities and towns are built to have safety and opportunities for people to connect, and you know, how our policies are structured so that families can meet their basic needs. All of those things that contribute to families being strong and supported in their protective factors. And so I think when we first, you know, 10, 15 years ago, when we talked about strengthening families being at the community level, we often meant like all the providers in the community are trained. That's still important. I'm still all for that. But I also think it means we're looking at policies and we're looking at community structures and we're looking at, is the librarian also trained, and is the grocery store family friendly, and all of these things that matter so much for families when they're thinking about the community they're raising their kids in. They're not thinking about their childcare program or their pediatrician's office or their home visiting program. That should be part of it, and hopefully that's a beautiful supportive part of their experience, but that's not what they would say is their community. And so we have to think about what else wraps around families so that their protective factors are strengthened. Anybody else want to jump in?
We talk a lot at the Alliance about the community conditions that support building protective factors for families, and really just what you said. The only other thing that I would add is like the Parks and Recreation Department. We this kind of relates to the opposite, but in thinking about things like community and societal neglect of families, we learned that a lot of families have to pay a fee to go watch their child play in a league, you know, or any even a community-based team of some kind. And so it really gets in the way of that whole family attention. And those are really just policies and practices that with enough awareness and intentionality, we can change. And how safe are the parks so that parents can actually talk to each other and know their kids are on, like, you know, if they're 2, they're on low slides and things like that. You know, is there a tot lot? I know a community that had one of those, and it was a huge place for parents to get a lot of social support because their kids weren't in high risk. They were in well-fenced small playgrounds. And just to think about those outside the box things that aren't social services but are huge.
Mm-hmm. The other thing I would add there too is the role of faith-based communities.
Mm-hmm.
And many of you have heard Pastor Dr. Daryl Armstrong speak about his work with families bringing their babies for baptism, get some home visits that are focused on protective factors to help them get ready for that and to just equip them with what they need as parents. And he's been doing a lot of outreach with other faith communities to sign a covenant about strengthening families as part of their ministry, which I think is really powerful. Because many families don't connect to any formal social services, but they do attend church or go to the synagogue or whatever other faith-based community. And so if we can reach them there and have the professionals they encounter there understand strengths and work in similar ways, then we can reach a lot more families with that kind of support.
Mhm.
And I love Maureen's comment about the community practice in Idaho called Hope Conquers ACEs, telling everybody about strengthening families. So really a really innovative way there in Idaho to say, oh, you want to talk about adverse childhood experiences? Well, let me tell you about hope. Let me tell you about protective factors. And we will also talk about ACEs, right? But really getting out into the community with those messages. Okay, let's take the most exciting questions, which is a group of questions about data and evaluation. So 5 different people entered questions that related to data and evaluation. And I don't think we're going to run through all of these in a lot of detail, but just to kind of address them generally. So someone was looking for info about outcomes instruments to measure improvements in protective factors. Someone asked how data is being captured, how people are using the protective factors surveys and evaluation, if we have data on how this works in Black communities, and then a very specific question about in the evaluation portal. So let's start with the sort of general questions about how people are capturing data and what that looks like. There are 3 validated survey tools in the field that measure parent protective factors. The first is the Protective Factors Survey, and the newer version of that, that's called the PFS2, Protective Factors Survey 2. Those are both revised, but the revised one is different enough from the first one that I consider them 2 separate instruments. And I'd say the first PFS is still a good quality tool. Some people continue to use that just because they already had a decade of data from using it and don't want to switch over to changing exactly how they're measuring things. The PFS2 is a great tool. I like that one a lot. It is asking parents questions about their own protective factors. It is designed to be used either as a true pre and post test, so the beginning of a parenting class or an intervention, and then at the end and see what the difference is. It has also been validated to be used as a retrospective test, so you can use it at the end of an intervention or at some point in your engagement and say what's changed since before you started this program. And then there's those 2. Then the third one is the Parents' Assessment of Protective Factors, or the PAPF. That one is from, I should say, the PFS is from the University of Kansas with support of the Friends National Resource Center. And then the PAPF is from the Center for the Study of Social Policy. It was developed through a Quality Improvement Center on Early Childhood. And each of them are validated tools. The PAPF is designed more for individual level work and really to feed into building an action plan or service plan with an individual parent, but it can also be used in groups. And for all of those, we have data showing that parents report improvements in their own protective factors based on a number of different interventions. There are some challenges with the pre-post. People tend to rate themselves pretty high on questions about their parenting before they start a parenting class, for example, and then might not have a lot of room for improvement, even if they can see themselves that they did improve. That's why the retrospective test can be really helpful sometimes. And it's good to see that the PFS2 was specifically tested and validated in that way. How that's being captured varies a lot. We don't currently have like a large central database that's capturing a lot of that information. So our partners at Mosaic maintain the Strengthening Families Evaluation Portal, which does capture parent surveys. it currently has the PFS in it. It will be updated to include the PFS2, but at this point it's the PFS. And we may also add the PAPF, but we're figuring that out with Mosaic. So that does give us some data, but it is mostly that individual programs would use it to see how parents with attached to their program would report their change over time. Goes along with entering the programmatic self-assessment data, staff survey that's in there. And a couple times Mosaic has pulled all of that parent data from across multiple programs that have put it in to look at the aggregate and has seen change. We can show change on the protective factors there, but that hasn't been done systematically and not very recently. Friends does have, for the PFS, there was a centralized database, an access database people could use, and they could download that database to use it on their own computers, and then they could submit that data. Not that everyone did submit it, but for those who did, they were able to do some analysis, but we don't currently have like one national database where people can share that data. The other question I'll answer here now, and then I'll stop talking, is about data on how this works in Black communities. I mean, the short answer to that is no. We don't have hard data on that. We have a lot of similar, recently, whether it's evaluations of parent cafe that's been implemented in majority Black communities, or in, well, just about any kind of intervention using strengthening families. We have heard a lot of really positive feedback, in particular from parents who have had negative experiences with systems before, or who have had family historical negative interactions with systems where their parents and grandparents said don't even talk to those people from, you know, DHS or from wherever, because it's not going to be a good experience, where they have really had a positive experience with a protective factors approach. And so that obviously is anecdotal and qualitative, and we don't have an analysis of that, but it is something we hear really consistently, is that the strengthening families approach for workers in systems that traditionally have had less positive interactions, that's a very mild way to put it, with parents, but also for parents who have engaged, whether that's that they're showing up for a parent cafe that's sponsored by their preschool or something, or for parents who are system involved in child welfare who have been invited to something like a parent cafe where they really have found it to be a different relationship and a much more positive experience than what they had had before. And I'm going to be quiet and see if anyone wants to weigh in with other thoughts about evaluation and data.
I think you covered it well, and I don't know if anyone in the group, I saw Maria Doyle added, and thank you, Maria, some information about the Friends database.
And I see Danny asked if we have a database you can download and use to capture data. We don't, but you can go to the Strengthening Families Evaluation portal. Right now, it's set up in a way that you need to request access, but they will see that and grant you the access, so you can set up an account and then send out surveys for people to complete. You can put your own program self-assessment into it. You get it has some really nice features that it can send surveys out to parents. They can turn it in anonymously, but still get a follow-up link that's going to 6 months later capture their response again and match it to their pre-response. So nice features like that take some of the burden off of the program for figuring out how to do pre-post without violating people's privacy. So I encourage you to check that out. Let me know if you have specific questions. I see this, the last question on this slide is about how you enter a group of 5 member surveys. I'm not sure the exact context of that. So if the person who entered that question is on, please contact me directly and I'll get you in touch with Mosaic and we can figure out what you're struggling with and get you past it. So, okay, let's go to a few more questions before we, oh yeah, actually, I think we might need to jump into our updates so that we don't run out of time. But please see the questions on screen and feel free to jump into the chat with your responses about protective factors for families facing specific challenges and the sort of getting started. I actually think we've covered a lot of what you would need to do if you're just getting started with strengthening families, but if some of those questions are still hanging out there for you, we can get to them in chat or on the Facebook group. So I am going to move us towards some updates. I know that, Maureen is going to share, and I'm going to let her show herself on screen. Maureen, let me make you a panelist, and I think you can show your camera if you want to. Okay. Maureen, are you able to unmute?
Yes, I can unmute, and yes, I can show my screen, and I even puffed up my hair. So, so do you want me to go ahead and start, Kaylin? Okay. Thank you so much for giving us this opportunity. Many of you know that I'm Maureen Durning. I'm the owner director of Butterfly Trainings That Transform, which is a strengthening families training and consulting firm here in Idaho. And many of you know that Jane Zink, my training partner, and I, we co-wrote a book a few years ago called Strong: Teaching the Strengthening Families Protective Factor Framework to Parents and Professionals. It's a long title, but it's exactly what is in the book. Within this book, there are 50 lesson plans that are all completely aligned with the protective factors. And our goal in writing the book was to try to move people, try to help agencies and individuals who wanted to incorporate strengthening families into their lives and into their work. We wanted to be able to move from knowledge into integration and then to accountability. So the book is available on its own. We've sold hundreds and hundreds of the books across the country and even in Canada. And I'm going to put in our website here in the well, I lost it. I'll put the website where any information is available. Jane and I have been doing Train the Trainer events on strengthening families materials since way back in 2008. And in the last few years, we've been doing Train the Trainer events on the use of our Strong book. And when COVID hit, we had always done in-person trainings, which I love to do. But when COVID hit, we started to get agencies who wanted us to do a Train the Trainer event. And we actually learned that these virtual events on training the content of the book work pretty well, surprisingly. I'm kind of getting to be a fan of these Zoom trainings. So we've done these, and we decided that for the first time, we're going to just open it up to the whole country, and we're going to do a Train the Trainer that will be on Tuesday and Thursday of the last week of April and the first week of May. And we're hoping that these 4 days over a 2-week period will be. We wanted to do it in doable chunks, and when we've done these in the past, we have found that just doing like 4 hours over a couple of days gives the participants a chance to sort of digest the materials and get ready for the next day. There's a list there of all the things that we do on this 4-day virtual training. What our goal is to be personal, practical, and progressive. Personal, you can't teach what you don't know. So we spend time identifying the protective factors in our own life. Practical, the lesson plans, these lesson plans are tried and true. They're well written, they're fun, and absolutely practical and applicable to what you're doing at your work. And then progressive. The reason we wrote a book with 50 lesson plans is that we've learned one training is just not enough, or even 2 or 3 or 4 trainings are just not enough. So with 50 lesson plans, we figure, okay, you can this stuff, you can do a whole series of parent classes, or you can do individual parenting sessions, or you can do one-on-one home visits with people, or you can use them for group meetings. You can use them for staff development. They're just very practical for many different settings and time frames. So the goal of the trainer is to familiarize you with the strong book and to help you to create an implementation plan for the next steps in becoming a Strengthening Families agency. So if you'd like some information, there's my website, butterflyttt.com. If you'd like to contact either me or Jane, there's our online strong1@gmail. And follow us on Facebook at Strong Families. So looking forward to hearing from you. I love this, Kaylin. I love all of the information because as we're going through all those topics, I'm thinking, yeah, we do that. We do that. We do that.
Thank you, Maureen. I'm going to have to rush
to
this along. Thank you so much for sharing this. I do need to get into the remaining updates we have from the Alliance and from CSSP. So go ahead and throw that link in the chat, and we're going to get through a couple more updates. I'm going to go right to this one.
Great, Kaylin, thank you. And we'll be quick, but this slide really is about a training we have coming up on March 24th. We have a number of these related to this birth and foster parent partnership work, but really this work is about building relationships, and we've been talking about that a lot today. They're free, available. You can sign up so that we can keep you posted as we do others. But all of this work is founded on the protective factors. So when you think about protective factors in multiple systems, this might be an opportunity for you. And we can go to the next slide, Kaylin. We have a new resource that we just unveiled a few weeks ago, but it's a discussion guide for parents. And again, people are talking about how to build parent partnerships to engage parents more. This is an amazing tool that was developed by a couple of people on our team. It's available for free download on our website, and the link is there. And we're going to be having some discussion groups about how to lead your own book club. And it's based on Bruce Perry and Oprah Winfrey's book, What Happened to You. Both of them have participated. Oprah came to the last book club meeting of the Parent Advisory Council in Georgia, and Bruce Perry came on a webinar that we did recently to introduce the book. All of this is all available on our website. So if you're interested, go to that location, and I will turn it over to you, Lucretia.
And I'll just be real quick. Web shared a lot about our website, so I won't take any more time, but we do have a training of trainers coming up in May. If you're interested in being a certified trainer for the Alliance and getting access to those virtual PowerPoints and all of the other things that go along with that, please sign up. We still have spots left. And also you can take the online version of the training, which is self-guided, for free, or you can get CEUs, and I'll put that link there in the chat. And just that we have, after this training, we'll have had over 1,700 certified trainers. So we'd love to have you join us. And that's all I have to say, Kaylin.
All right, thank you. I'm going to just quickly share last month's webinar. We talked about the perspectives on early relational health. Those videos, 3 have now been released, and our 4th one we just recorded last week. It was amazing. I can't wait for it to be edited and shared. So please take a look at those and feel free to share them. We're also developing discussion guides that you can use to use those in staff meetings and other ways where you might get a discussion going about early relational health. We also just released a paper this week called Systemically Neglected: How Racism Structures Public Systems to Produce Child Neglect. I think that's something we're all interested in. So I encourage you to go to our website and download that paper. And just another reminder that families still need to file to receive their full tax credit by April 18th. And even for folks without kids, the earned income tax credit is higher for 2021 than usual. So please get out there and encourage people to file their taxes, even if they don't usually have to file. And we have flyers in English and Spanish on our website that you can use to help parents understand what they need to do. And finally, this just save the date. We have the Together for Families conference coming up this fall. It'll be a virtual conference, October 19th to the 21st. We just got past the deadline for putting in session proposals, and we were blown away. We've actually decided to add some more breakouts so that we can accommodate more of those amazing proposals that came in. So we're really excited for that and hope that lots of you will be joining us in October. Again, that will be virtual. All right, and that I think is all we have to share today. Thank you for everyone who submitted questions, and thanks to Lucretia and Teresa for jumping in and answering so many of them. And Maureen, thank you for sharing your update as well. Really excited about all this good work that's going on. I am going to stop the recording and stop sharing my screen, but I see there's still a request for some links in the chat, so we won't close it up quite yet. Thank you all for joining us.